Welcome to this Q&A session with Professor Tim Child from the Fertility Alliance. And today we're looking at whether you can tell if you've got a fertility problem. So, Tim, is it actually possible to know if you've got a fertility problem?
I wouldn't say necessarily you can know, but there may be some pointers. I mean, the main thing is there an issue getting pregnant? So when we talk about what is a fertility problem, first of all, how long has someone tried to get pregnant unsuccessfully? Nice guidelines suggest you try for 12 months, and if not pregnant, then consider going on for testing. But certainly by 6 months, most people might be worth an initial chat with the GP. If you're thinking about starting to get pregnant but haven't tried yet, then I guess irregular periods might suggest that you need some investigations for ovulation. If you know you've got something like endometriosis or you have very painful periods or a time around the period, if you've had surgery on the abdomen, or if a man perhaps has had surgery or trauma to his groin area. So they may be some pointers. And I suppose another one would be if someone has an underlying medical illness, again, you want to make sure that is under control.
So, if you had those things, would it necessarily mean that you're definitely going to have a fertility problem or just that you might be more likely to?
No, certainly it would definitely not mean that you are going to definitely have a fertility problem. So most people, even with those things that I've spoken about, don't have a fertility problem. But it's just important to be aware of it. And I think if you have any of those things that I mentioned, and you've not got pregnant after 4 to 6 months of trying, that might be the point then to have an initial chat with a GP.
I was going to ask about that. I mean, would that be a reason to start on the test process earlier if you're actually trying to get pregnant, if you've got any of those things already?
Yes, I think it would be. So the nice guidelines suggest that or for women who are in their later 30s or beyond, that maybe once you get up to about 6 months of failure to conceive, that it probably is worth starting the process of testing.
And there's quite a lot of talk nowadays, quite a lot of clinics are offering the kind of fertility MOT test. I mean, what's your view on those? Is it a good idea to go and get one of those?
Well, I think a lot of that actually is more, it's used to be called like a one-stop thing, actually. I think it's difficult to do it in one stop, but that was the older name before the fertility MOT really gained traction. And I think what it's really getting at is the traditional route would be people would go to their GP, have a chat about their fertility. The GP might run a couple of blood tests on the woman, maybe send the man off for a sperm test. And then, a few weeks later, come back. Then there'd be some more tests being done. Then they'd get referred into the hospital fertility clinic. And then there'll be some more tests being done. So it could really drag out over weeks or even months sometimes. And I think then what happened was, private clinics started to have patients asking, well, can't I just have it all done in a shorter time? So sometimes in one day, but more likely over maybe a couple of visits, everything can be done. So I think for most people, having those things done before you're starting to try and get pregnant, I don't think is of any value. And I think you might be picking things up which really are meaningless and might actually worry you. So, but I think if you're not getting pregnant, trying to get answers as to is there an underlying problem? Yes, generally is going to be quicker if you pay for it and go for a fertility MOT. But whether it's any better than doing it the traditional route via the GP in a fertility clinic, probably not. But it's just quicker.
So, what kind of things should one of those MOTs or whatever they might be called, what
Yeah.
should they be looking at? What things should you expect to be in one of those?
Well, I think the important tests really, if you have a heterosexual couple, a sperm test is important. It should be one of the early things that's done. And I think sometimes what happens is because often the focus, for whatever reason, is on the female side in heterosexual couples, sometimes the sperm test can be done surprisingly late. And obviously, if there is a significant sperm problem there, then that's what's going on. So usually it would be a sperm test. There would also normally be an ultrasound scan of the woman's pelvis, and that's looking to see, does the uterus look normal? Are there any polyps or fibroids in the uterus? Are there any ovarian cysts? And what's the antral follicle count, which is the number of little resting follicles in the ovaries, and that's a measure of ovarian reserve. They might also be doing a blood test for ovulation, sort of a mid luteal or day 21 of a 28-day cycle. And they probably will be doing an AMH blood test. So AMH or anti-Müllerian hormone is the best test of ovarian reserve. But your AMH in a woman with regular cycles, her AMH level is not related to the chance of natural conception. So we use AMH a lot in IVF clinics to help decide drug dose and things like that. But in terms of investigating why people aren't getting pregnant naturally, AMH actually is not a very helpful test, but you almost certainly will find it wrapped up in a fertility MOT.
Talking about a regular 28-day cycle, we know that not everyone does have a regular 28-day cycle, but what would constitute a still regular cycle or something that you needn't worry about that isn't actually 28 days exactly?
It's a very good question, actually. And I probably shouldn't have said 28 because you're quite right in that as long as a cycle is regular, then that is highly suggestive of ovulation. And in fact, the American Fertility Society or ASRM guidelines have just come out for what tests should people have for fertility. And they've actually said that people with regular cycles should not have a progesterone blood test because if you have regular menstrual cycles, it doesn't matter whether they are regular 25-day, 28, 31, 35. If they are regular, the reason that the periods are regular is because an egg is being released. And then 2 weeks later or so, if there's no pregnancy, the period happens. So, yes, I think regular is more important than thinking about 28-day.
And sort of small discrepancies in that regularity, does that matter? I mean, when would periods be called, what would make them irregular? Would it be missing months out and things like that?
Yeah, I mean, and there's no sort of strict definition of that. You're quite right that again, even when we talk about regular, and sometimes people will bring in an app and they've tracked everything and they'll say, well, this month it was 3 days shorter, this month's 3 days longer. We would still consider that regular, in fact. And once a period's are probably more than about 6 weeks apart, particularly if they're variable more than 6 weeks from day one to day one, then because it'd be unusual to have a regular 2 month cycle would be very, very unusual. So once a period is more than 6 weeks or so apart, that probably would then be considered sort of irregular and then further investigations undertaken.
Okay. And is there anything people can do themselves? I mean, if they are worried about any of these things or worried about irregular periods, is there anything you can actually do yourself that might make a difference?
Yeah, well, I think one thing to look at, I mean, lifestyle is important. So certainly the woman's general health, and we generally talk about BMI, body mass index, and there are limitations of BMI. If you have someone who's a muscular athlete, then her BMI may be a bit misleading. But for most people, that's not really the situation, and the BMI is quite a good representation of body fat. So people with a higher BMI are more likely to have irregular or absent ovulations, particularly if they've been born with the genetics of polycystic ovarian syndrome, so PCOS. So I think optimizing BMI, or if it's too low, in fact, that will also lead to irregular periods or irregular ovulations. So I think optimizing body mass index, eating healthily. People talk about the Mediterranean diet a lot, which is really a multicolor, mixed, freshly cooked diet, and those sorts of things can help. Taking things like supplements, I don't think are going to improve the regularity of ovulation.
And what about for men? Is there anything that they should be doing at the same time?
Yeah, so I think again, diet, and there's a lot of information now. There are studies actually coming through suggestive that this adherence to a Mediterranean style diet can be good for female and male fertility. I think from a male point of view, I mean, the supplements is an interesting one. So women should be taking folic acid and vitamin D if you're trying to get pregnant. Absolutely. Ideally starting a couple of months before you're trying to get pregnant. Whether there's a benefit in taking more supplements than vitamin D and folic acid for women is not clear. It's not going to do any harm. So certainly, I think the pregnant care conception type ones have got everything in it, including vitamin D and calcium, and that's what I often suggest. On the male side, again, it's not been shown that taking supplements is absolutely necessary, but I can understand people might prefer to feel as though they're doing something, and there maybe some benefit in some studies. So I think the Wellman or the Testim type supplements are sort of focused on fertility. And I think from a lifestyle, smoking is really bad for male and female fertility. Vaping also appears to be bad for male and female fertility. Alcohol and caffeine, my view is people don't need to stop those things altogether, but just be sensible about it and bring the levels down. And I think from a male point of view, the you often hear about cycling, so people who are very, very keen cyclists, that may not be ideal for sperm quality if someone's doing, you know, a lot of cycling and all in lycra, etc. So maybe just pull back on that a bit. And the other final thing to say is lots of saunas, baths, and jacuzzis for men are probably not a good idea either.
Great. Just to summarize, what would be your key advice for someone who is a bit worried about fertility, what they might look for and what they might do?
Well, I think it's good to be proactive about things. So certainly taking a step back and looking at your lifestyle generally. So I think looking at your lifestyle, making easy changes. So just trying to eat more healthily, cutting down. If you stop smoking, don't vape, and just some of those multivitamins that we spoke about. Um, on the female side, if your periods are regular, that is very reassuring that you're going to have regular ovulations. Um, and I think if you're not pregnant by 6 to 12 months or so, then that would be the time to start having some investigations, including a sperm test. But 80% of people will get pregnant in the first 12 months of trying. So even if it hasn't happened after a few months and it seems as though all of your friends are getting pregnant and you're surrounded by pregnant people, and obviously that's distressing, but 80% of people will get pregnant in the first 12 months of trying with no medical treatment or anything at all. So it's important to bear that in mind. But there are things that you can do to be proactive about it and to help push yourself into that 80%. I think getting information is important. So the more informed you are, because there's a lot of rubbish out there about tests. It's a very commercialized area, and I often see people who have, have probably backed into a corner a bit where they've had lots of tests and things. The more tests you have done, just statistically, the more tests you have done, the more likely you're going to get an abnormal result, which is completely meaningless. And you then potentially go off down into a rabbit warren of treatments that are probably of no value and have risks and certainly have costs. So I think get information. I mean, certainly, obviously, the Fertility Alliance website will be having lots of information on there. hfea.gov.uk has got information on there as well. So get informed to help yourself make an informed decision.
Brilliant, Tim. Thank you so much. That was incredibly useful, and you'll be able to find more Q&A sessions like this from the Fertility Alliance in the future.